I'm Florence Haseltine. I'm the founder of the Society for Women's Health Research. I think I've worked with the society before it was born. In the 1980s, most of the focus on women's health was on contraception and reproductive health issues. I had been hired at NIH to be the director of the Center for Population Research. I would be called as a gynecologist to say, what would women think? We want to do this study on progesterone in postmenopausal women. And I would say, you can't do an endometrial biopsy on a woman every month. But all the people were medical docs. They weren't gynecologists. They did not understand, one, the practice of gynecology, what we saw, how we did things. So I was used to being the only of anything. And the one lesson I learned is you have to get other people. With the help of many of the advocacy groups here, we started to get some interest in Congress. At that point, I did not know the information about women not being included in clinical trials. But the Women's Caucus was very good because they turned up a piece of evidence saying that women should be included in clinical trials. And by September, they had organized the Office of Women's Health Research. Things started to move fast.
In the 35 years since the Society for Women's Health Research was founded, there have been some major tentpole moments that we've been a part of. Just a few years after we were founded, in 1993, women were first included in clinical trials. Then in 2016, sex is a biological variable, the rule was put into place. And then just in the last year and a half, we've seen a renewed effort by the federal government to focus on women's health research. This powerhouse of an organization is a major reason that we have offices of women's health in the federal agencies.
Probably the landmark piece of legislation that SWHR was involved in was the NIH Reauthorization Act, which was passed in 1993 and requires that federally funded clinical research include women as well as racial minorities. And we've really seen the impact of that law because now about half of clinical trials do include women. We're seeing better minority representation, although we've got a long way to go there.
The steadfast and consistent prioritization of women's research and the real focus on advocacy, whether that's with politicians, policymakers, or among private sector and even with patient groups, has been, I would say, the hallmark of the work of SWHR, bringing new women's health organizations into the space. SWHR has really been not just a key partner, but I would say a key driver of the women's health research community.
We like to say at ORWH, we put science to work for the health of women. But that science can't have its full impact if it doesn't reach every woman everywhere. That's where societies like the Society for Women's Health Research have played a key role. And I would say SWHR is the leader in this space and has advanced the concerns of women and the importance of biomedicine in meeting those concerns for so many years.
We held a lot of conferences, a lot of workshops, a lot of symposiums. That allowed an interchange of ideas, and it was nationwide. The second thing, which I think that cannot be underestimated, is a group of meetings we had in the early 2000s called SAGE, Sex and Genetic Expression. We were able to bring scientists literally from all over the world. So people from behavioral sciences, from psychology, from neuroscience, all different fields, geneticists. I still hear today how those meetings influenced the direction that the scientists later took. So we created a basis of scientific expertise in how to do studies.
We are seeing much more open conversation about women's health across the board. And it's not just when it comes to things like menopause, which is having a bit of a moment right now, but also when we think about menstrual health, maternal health, autoimmune conditions. We are now seeing people talk about the fact that 80% of autoimmune patients are women. Stigma and endometriosis as an example. Up until just a few years ago, we weren't hearing much about endometriosis, probably because of that stigma, but we were able to publish a paper with our working group related to that. And so we're finally having these conversations out in the open and in the mainstream.
Celebrating the Society's 35th anniversary is a testament to their longstanding commitment. whether that is advancing policy or educational resources, that commitment is incredible. So sex differences research and the seminars that have been put forward are a key area. Policy advancement and support of policy like the sex as a biological variable policy is another key area. But advocacy and being the voice of women across the board, across government, the public, and entire research ecosystem, the importance of that advocacy cannot be overstated. SWHR is making women's health mainstream.
SWHR is making women's health mainstream.
SWHR is making women's health mainstream. SWHR is making women's health mainstream.
SWHR is making women's health mainstream.
The Society for Women's Health Research is making women's health mainstream.